Some cancer, it could spread to other organ like adrenal and give us this oncologic emergency, what we call it adrenal crisis or adrenal insufficiency. These cancers are melanoma, lung cancer, breast cancer, renal and other retroperitoneal cancers. Again, adrenal insufficiency, or what we call it a crisis, it could happen with withdrawal of chronic steroid treatment, infection of adrenals, and adrenal hemorrhage. Symptoms, most of the time, weakness and fatigue and thirsty. The sign of adrenal insufficiency, or what we call it adrenal crisis, including dehydration, hypotension, hyponatremia, hyperkalemia, hypoglycemia, and eosinophilias. The most important things for us, we should differentiate between primary lesion of the adrenal causing adrenal insufficiency or adrenal crisis, like cancers, pheochromocytomas, other neuroendocrine tumors. All these cancers, we call it a primary adrenal cause. But in this oncologic emergency, we are talking about secondary causes. What we call it, it's metastasis to adrenal. Cancer is spreading to the adrenal, causing these abnormalities. What we should do or how we can make a diagnosis, it's including serum electrolyte, kidney functions test, serum cortisol. Sometime we should do MRI to identify the source of the metastasis. Other important factors to rule out pheochromocytoma if it's not clear or the patient is not diagnosed by adrenal metastasis is to do metanephrine, serum metanephrine, and urine metanephrine. This will increase the accuracy of pheochromocytoma by around 97%. Start treatment. It's really important. When you suspect adrenal insufficiency, you should immediately start treatment and make sure that you'll follow up the patient. If you suspect this oncology emergency or adrenal insufficiency, don't wait for a blood test. Immediately give medication and confirm that with a blood test. Treatments including intravenous fluid, you give a lot. Intravenous steroid, at least 300 milligram of hydrocortisone per day initially, plus minus calcium, bicarb, and insulin for hyperkalemia. You could give also intravenous glucose. Evaluate for a source of infection if you think this is not coming from cancer, or if you think that there is an infection in top of cancers.